Nananamlay na ba ang labing-labing ninyong mag-asawa? Nako, hindi pwede yan. Mahalagang masatisfy ninyo ang isa't isa.
Tuloy mo, Papo.
Oo, mainam na malaman natin ang mga tagong problema ng mga mag-asawa. Baka kayo po ay nakakaranas na ng tinatawag na sexual dysfunction. So,
At
tulungan
hindi
mo
lang
tayo.
lalaki yun, ha?
Oo.
Jules, hindi lang lalaki
Babae at
nakakaranas.
lalaki.
Babae at lalaki yan.
So, tutulungan tayo ni Dr. Jennifer Jose na isang aesthetic gynecologist. Doc, magandang hapon.
Hi, Doc. Welcome back.
Good afternoon.
Doc Jennifer, can we call you Doc Jen?
Yeah, just call me Jen.
Yes, Jen.
Thank you.
Pag-usapan natin na, Papo, tungkol to sa mga babae naman. Yung female sexual dysfunction. There is such a thing.
Yes.
Oo, can we define that muna, Doc?
Okay. Yung female sexual dysfunction, ito yung condition na yung mga babae nagkakaroon sila ng malaking problem in terms of enjoying intimacy, no? Actually, there are 3 different kinds. Yung isa, tinatawag na hypoactive sexual desire disorder. Yung wala silang gana makipag-intercourse. Yung iba naman, yung second, tinatawag na female orgasmic disorder, meaning they don't achieve orgasm. Yung third naman, tinatawag doon yung genitopenetrative disorder. Hindi sila nagkakaroon ng enjoyment with intimacy because there is a lot of discomfort when they have intercourse.
Wow, ngayon ko lang nalaman yan.
So, paano nagagamot yung gano'n, Doc?
Sige, kasi alam nyo, ang pinaka-common dyan, yung hypoactive sexual desire disorder. It's like saying that 80 to 90% of women, especially when they reach perimenopause to menopause, nawawalan sila ng libido.
Bakit kaya, Doc?
It's because of hormones. Remember?
What happens ba to our bodies pag menopausal
sige.
na nawawalan ng libido ang babae pala, babae.
Kasi ang nangyayari, yung estrogen and progesterone bumababa. No?
Okay.
Tapos yung testosterone ng mga babae, constant lang. But the thing is, kung mababa na yung estrogen, what happens is that, number 1, nagiging dry ang mga babae, right? Nawawalan sila ng gana to have intercourse.
Kasi masakit, they'll dry.
Masakit.
Oo.
And because of that, they think it's not important anymore. They don't have intercourse. They're not intimate with their partners na. So yan, nagkakaroon ng problems with marriages. Diba?
Kaya yung mister naghahanap ng iba.
Oo.
Ganon.
Kung yung iba, ganun din ang problema. Anyway, going back, Doc. Sige.
Right.
So, anong dapat gawin?
Okay.
Oo.
Well, number 1, kasi yun ang pinaka-common hypoactive sexual desire disorder. Ang pinakamaganda dyan, yung mga females, they have to go and see their gynecologist. Kasi ang unang first na pwedeng treatment dyan is actually hormonal. But you cannot just buy hormones over the counter.
Right.
You have to see your doctor para sure kang wala kang problema before you take it so you don't get the side effects. Right? Like for instance, kunyari, iinom ka nito mga hormones na to, pero meron ka mga breast cyst or breast mass. Some are actually sensitive to hormones, so baka lumaki sila. Right? So you have to see your doctor before taking this.
Yeah.
It's not very common here in our country with regards to yung mga female sexual dysfunction. But you know, in the US and in Canada, there are already medicines na binibigay. Yung mga medicines na it's called filbanserin na you take 100 milligrams a day para bumalik yung libido and also gana mo to have intercourse again. Yung iba naman, they are actually injectables that you give 30 to 45 minutes before having intercourse.
Medyo masalimuot yan kasi i-inject mo pa.
Parang Viagra sa babae. Parang ganun.
Para siyang Viagra sa babae.
Good question, Papo. Parang may alam ka dyan.
Yes.
Mag-inject ko na ako sa mama. Joke.
Ayun, wait, that's a good point. Pwede bang inject yun ng asawa sa kanyang asawang babae?
Pwede. Ang problema, wala sa Philippines.
Ay,
right?
Papo, sorry ka na. Wala sa Philippines.
Pero ang mga meron natin sa Philippines are mga creams, okay, na linalagay sa vagina, okay, para mag-improve yung moisture. Women will also lubricate again and enjoy intimacy. So, meron tayo niyan. Meron din mga creams na linalagay sa breast, okay, para mag-improve yung contraction ng uterus. And because of that, they will enjoy intimacy more.
Interesting yan,
Minsan ba, Doc, psychological yung problema?
Merong psychological effect yung iba, especially yung iba na nagkaroon ng trauma. Diba? So, it's so hard kasi, when you treat these people, hindi lang dapat gynecologist ang pupuntahan nila.
Kasi if it's the mind.
Yes, it's multidisciplinary. So, you also have to see sometimes psychiatrists or psychologists to help you.
Yeah,
Kasi
yeah.
pati ang treatment nito, it's not just like medications na sinasabi kong creams na ipapahid.
Yeah.
Meron tayong mga biofeedback treatment, meron tayong mga cognitive behavior therapy na ginagawa. So, you know, you look at the person, not like in one area lang na, okay, dapat sa OB ka lang pupunta. Hindi. You have to look at the person holistically.
Tama.
Ayun,
Tama
magandang
Papo.
ano yun, magandang
point.
point yun kasi baka may mga couples na hindi sila nagde-declare sa isa't isa na meron ganyan.
Oo.
Yes.
Yeah.
Di ba? Kapag nagsama na,
Yeah.
that's the time they realize na may problema pala.
Oo, kaya importante, Doc, yung open lines of communication. Kung kaya mo i-open up sa gynecologist mo kasi female to female.
Yes, yes.
Kailangan sa asawa mo, sabihin mo rin. Para
Sabihin
naintindihan
mo.
ng asawa mo.
Or sa boyfriend.
Dahil baka, or boyfriend.
Pa lang, di ba? Sabihin mo na.
Kung
Right.
if they're
Oo.
engaging in
Pero,
premarital.
you know what's happening now? Kasi sa culture natin everybody's very quiet about it, di ba? But I think now yung mga kabataan ngayon, they're open kasi magugulat ka. Now they are the ones approaching you for these problems.
O tama yung
So, which
tulad
is
sinasabi ni Vince kanina,
Yes,
no? Iba
yes.
na talaga yung generation
Iba na yung
ngayon.
generation
So, kabataan
ngayon.
pa lang, as young as meron na silang itong sinabi
Yes.
yung mga
Yes.
sexual
Like,
dysfunction.
you'll be
As young as
surprised.
what?
Mga ilang taon?
18, 20. I've been
18,
seeing a
okay.
lot of teenagers
Ayan, yung mga may
nowadays.
trauma.
Oo.
May trauma.
Na meron
especially.
silang vaginismus. Are you familiar
Ay,
with
no,
vaginismus?
Doc.
Oh, tell
What
us
is
about that.
vaginismus?
Vaginismus is a condition na nagtitense yung muscles, okay? So what happens is that hindi pwedeng magkaroon ng penetration. And because of this strains a lot of marriage kasi 'di ba if you cannot do that, you know, it is one form of a way for having annulment, right? So marami akong nakikitang bata na may ganitong
Pero anong
problem.
reason? Anong cause?
Well, number one is it can be like your pelvic floor muscles are nagtatighten. No?
May psychological
yung
reason
iba
ba yan?
psychological.
Oo.
Pag psychological, mahirap na siyang i-treat kasi you need a psychiatrist, psychologist, you need therapy. But like what I do in my patients who kasi, as a gynecologist,
Yeah.
you know, of course, I talk to them. I need to help them see a psychiatrist too. But I also inject Botox. Are you familiar
Para
with the
mag-relax.
Botox?
Yung Botox
Yes.
para sa
Sa
mukha.
face? Oo.
You inject it there
There,
sa...
sa elevator muscles.
Anong epekto?
It will relax it.
Really?
Yes. So as long as there is no psychological condition, when you relax the levator muscles inside the vagina, it really helps. So I think I've mentioned before when you interviewed me that I was able to save marriages.
Yes, you did.
Yan, kinento mo sa amin yung Doc. Oo.
That's very good kasi ngayon nasa 52 na ako. Di ba? Dati 47. So ngayon, meron na ako mga 52 marriages na na-save because of this.
Nadagdagan pa.
Dahil lang
Yeah.
doon sa that particular Botox.
Yes.
That
Kasi
treatment to
na-relax.
Gano'ng katagal ang effect nun, Dok?
Normally kasi when yung eject yung botulinum toxin na yun, Botox kasi sa brand name botulinum toxin.
okay.
Usually it lasts for 9 months. But I tell you, so far with these patients na nagawan ko, after injecting it, hindi na ako umulit. So nag-relax
Nag-relax na talaga.
Nawala na yung stress. And you know, after that, we also use mga vaginal dilators to help them. We also offer biofeedback treatment. These are mga sessions para makilala ng patient yung condition ng body niya. She knows when to relax,
May
when
ganun
to
din pala,
contract.
no?
So it's really a treatment. You know, it's not very known yet in the Philippines.
Yeah.
But you know, especially in Europe, you know, they do this a lot.
Pagka ang babae ba nag-menopause na, nakaka-cause ba yun ng sexual dysfunction, Dok?
Also, it contributes. Why? Because of menopause, you age, so you become dry. There is less lubrication, right? And then the tissues becomes very thinned out. And because of that, there is what we call genitopenetrative disorder. Kaya ayan na, meron tayong vaginismus. Yung iba may tinatawag na dyspareunia, yung pain during intercourse. Meron din yung iba, maraming conditions. Merong vestibulodynia, wherein it's just very painful, even just to touch the vulva, but there is like redness. and then it will stay there for 6 months, and it causes a lot of discomfort. Marami.
Doc, sex can be very complicated.
Oh yes, I got surprised too
At a
with
certain age.
At a certain age, especially.
yes,
Diba?
yes. Lalo
That's
na
why-
pagka inaral mo, naku, mas
Diba?
lalo.
Kasi you have to understand your body and
Right.
yourself and what goes on in your mind. And then explain it well to your husband or partner.
Right, oo.
Diba? And the partner must be open to it.
Yes, yes.
Hindi yung parang iisipin
Nagtatampo.
niya na tatampo.
Oo, ayaw mo na, ha?
Nako-offend.
Diba?
Yes.
Okay,
Hanap tala akong iba.
Or kaya
Right,
sabihin,
right. Diba?
ay,
Oo.
yung performance ko ba may problema?
Oo.
Parang na-insulto naman ako. Hanap ka ako na iba
Ayun na.
who will validate my
Validate.
Naghahanap
performance.
ng dahilan yung ibang lalaki para
Hindi ganun yung iba, di ba,
That's
Doc?
true.
Oo.
Kaya nga-
Pero kung open ang mag-asawa,
Oo.
we're talking about papo-babae, no?
Oo. No, actually, you know what I do with my patients? I see the patient, I talk to her, and then I tell her na, if you want to be successful, let's bring your partner or your husband in.
Tama.
And then,
Tama.
Pagka maayos na tayo, if we think na kulang pa, then that's the time we call a psychologist to be part of it. Which is good. Maraming gustong umokay eh. Yun ang maganda
Kasi
dun.
pag nalaman mo, it's beyond a gynecological problem
Yes,
or
I refer
physiological.
already.
Yun na,
Oo,
to help the marriage.
Yes.
Doc, what about over-the-counter solutions? Meron ba?
Well,
walang
yung
reseta.
over-the-counter.
Yung-
Sige.
over-the-counter.
Let's say if it's over-the-counter, you have like lubricants over-the-counter. You don't need to get a prescription for this. You can use that, right? But of course, yung hormones kasi plays a very important role. But I think you have to see a gynecologist for this.
For the hormone. Not everybody can take hormones, no? Hindi
Yes,
lahat ng babae
yes.
pwede mag-hormones.
Oo, at saka you cannot buy it over the counter. So I think that would really help. Pero yun na nga, it has to be multidisciplinary.
Paano
Galing,
ka
no?
kukontakin, Doc? Dun
Oo,
sa mga
very
viewers
interesting
natin
ang
na gusto
kausap, Doc.
magpa-consult.
Okay.
Ano?
Well, I have a new clinic right now for mga intimacy problems. It's called Intima V Health and Wellness Center. It's actually at the Medical Plaza Makati, room 1005.
Okay.
Ano mga socials mo, Doc?
Yes, socials, Doc.
Social
media.
Well, my social media, I have, of course, my Facebook. It's jenniferjose.com. Yun lang naman so far. but-
JenniferJose.com is
Yes.
a website.
Website.
Website
okay.
siya, website.
Yes.
So, pwede kayong
Ayan,
i-message
ay,
doon sa website.
Yes,
na yun,
yes.
no?
Oo, common types of sexual dysfunction. Ayan,
Ayan, may Instagram kayo.
Oh,
Dito.
yan. Meron din.
Pelvic Health
and Intimate Wellness
Center.
Ayan, pwede kayo mag-PM
Yan.
dyan.
Right.
Oo.
Oo.
Ganda.
Ayun, thank you
ayan,
so
ayan
much.
na.
no?
Meron din sa
Ayan,
Thank
ito,
you
may
also.
Facebook din, no?
Right.
Thank you. Do message Doc Jen para yung mga problema nyo sa marriage, di ba? Matulungan kayo ni Doc Jen. And of course, kung hindi kayo married, you don't
Yeah.
have to be married to have these problems,
Oh, yeah,
right?
yeah. Yes,
You
yes.
don't have to have a partner to have these problems,
Right.
di ba?
Uh-huh.
Kung ikaw sa sarili mo, babae
Alam mo na
ka,
na may
alam mo na
problema
rin kung anong nararamdaman mo, di ba? Yung
Sabihin,
solusyon.
May chance pa.
Yes.
May kakaproblema mga mag-asawa.
Thank you, Doc.
Thank you.
Thank
Hope
you.
again.
Thank you also.
See you soon.
Yes, see you.
Again.
Magandang po kayo, ha? Dahil magbabalik pa rin ako.
At Tintin para sa pamilyang Pilipino.
Juice and Tintin para sa pamilyang